going to welcome Dr. Michael Weisberger, who is from the Jefferson Department of Family and Community Medicine, and he's going to be leading today's presentation on diabetes. So this is also his first presentation with us as part of the Doctor's In, so be nice, and we will turn it over to Michael. Please give him a nice welcome.
Thank you. Thank you very much. I'm really happy to be here to talk about one of my favorite topics, which is diabetes. I think we have so much to talk about that I tried to distill it down to just the most important points. But please feel free to ask any questions you might have. Can you all hear me? Is this loud enough? Yeah. Interrupt me if you can't hear me. I really think I really enjoy talking about diabetes. So ask anything you guys have any questions you guys have, all right? So what is diabetes? This is we hear a lot about diabetes in the popular culture, on TV. We have family and friends who have diabetes. It's kind of made its way into the popular dialogue. So when I think about diabetes, I have a whole bunch of ideas that pop into my head. Food, I think about. I think about the kinds of things that we eat and how it affects our health. I think about our weight. I think about our activity and exercise. I think about doctors. I think about nurses. I think about medical care and medicines. Diabetes is an incredibly complicated topic, but we can really make it understandable, and that's my goal today. So these are just some words that you might have heard of around the topic of diabetes. We'll talk about some of these, but not all of them. So again, what is diabetes? So at its core, diabetes is a disease where your body has too much glucose in the blood. So what is that term glucose? So glucose is sugar. It's another word for a kind of sugar. So this is sugar, right? We have sugar here on the screen. This is natural sugar, but it's still sugar. It's called sucrose, but it's a kind of sugar. Glucose is also in fruits. It's also in vegetables. It's in things we like to eat, like pizza, and there's a lot of glucose or sugar in ice cream or sweet things. Basically, our body takes all of the foods that we eat, and it turns a big proportion of what's in that food, whether it's fats or sugar or carbohydrates, into glucose, which is the main fuel for our body's cells. Our body then uses that glucose, that fuel, to do everything. So it uses that glucose to think, our brain does, to move around, for me to use my muscles to speak, to breathe, for our liver and kidneys to work, for our heart to pump. All of our cells need fuel, and that's what glucose is. So then another related topic is this thing called insulin. Who's heard of insulin? A lot of people. So insulin is this thing that your body makes. It's a hormone that your body makes. And the purpose of insulin is to help your body use the blood sugar or glucose that's in your blood and help your cells take it up to use that fuel, because it can't get at that glucose. Your cells can't pick up that glucose and use it without insulin. It's in the blood, it's not in the cells. We need to get it into the cells. Insulin is a part of that, and we'll get into a little bit more detail.
Could you say that the glucose where it backs up in the blood?
So the question was, could you say that glucose backs up in the blood? So you'll see later that the problem is that you have too much glucose in the blood. So yeah, it kind of ends up staying in the blood instead of going into your body, into the tissues in your body. So this is another sort of representation of what glucose or sugar is, what insulin is, and then what it does. So you can think about glucose like this fuel, it's sugar. Insulin is like a key, and then on your cells, every cell in your body, you have these little locks that insulin opens up and lets the blood sugar in, lets the glucose in. Your cells can't use that glucose without that insulin. Does that make sense? So a little more detail on how this all works. So first, when you eat something, anything, that sugar makes its way into your bloodstream via your digestive tract, so your stomach and your small bowel and all of these, all of your digestive tract. The whole point is to get those nutrients into your blood. When you do that, your pancreas, one of your organs, senses that increase in blood sugar and releases the hormone called insulin. So that's the first step. Insulin is released into the blood. And here you got a little schematic of the bloodstream, which is the little vessel, the little white part. Insulin is the key, and blood sugar is the little blocks of sugar. And then the second step, the sugar and the insulin mix up, travel together in the blood everywhere. Then insulin arrives at a cell and it unlocks this door, and then sugar is absorbed into the cell or allowed into the cell. And then finally the sugar goes into the cell and the cell starts using it, the glucose, to do everything, to do all of its activities that it needs to do. So that's kind of how it's supposed to work. That's how the body normally works. So now let's talk about the different kinds of diabetes and what happens to change that normal mechanism, how the body is supposed to work, what happens when you have diabetes. So there's 4 kinds of diabetes. The first one is called type 1 diabetes, then type 2 diabetes, then something called gestational diabetes, and then the last thing is kind of a precursor to diabetes called pre-diabetes. Those are the kind of 4 main types or concepts around diabetes. So what is the first type? This is sometimes called youth onset or juvenile onset diabetes. Usually starts at birth, but really people start noticing it around the teenage years, age 13, 14, somewhere in there. It's about 5% of the diabetes around the world is this type 1 diabetes. So it's not the most common type, but it's not extremely rare. What happens in this type of diabetes is that your own immune system starts attacking the cells in the pancreas that create insulin. So your body starts not to be able to make enough insulin, and then you have a buildup of that glucose in your blood because you don't have the insulin needed to deal with that blood sugar. One of the important things about this type of diabetes is you can't really prevent it because it's not just genetic, but it's autoimmune, and it sort of happens without us knowing. There's no way to prevent this, but there are ways to treat it. So that's the first kind of diabetes. Type 2 diabetes is more common. It's about 90% of the diabetes that we see worldwide. It's more typically adult onset. Average age is a little older, 45, but we're starting to see younger people develop diabetes too, as young as the teenage years or younger. But typically it's a disease of adults. It is genetic, so if you have a first-degree relative, a father or a mother or a sibling who has type 2 diabetes, you're about 5 to 10 times more likely yourself to develop diabetes. And the problem in type 2 diabetes is a little different. So in type 1 diabetes, remember, it was the body's not making enough insulin. In type 2 diabetes, the problem is that the body isn't using the insulin as well. There's a concept that we like to talk about called insulin resistance, which means that your body's cells, the lock and key isn't working as well. So the key isn't maybe unlocking that lock and letting that glucose, that sugar, that fuel into your cells. There are lots of reasons that our bodies develop insulin resistance. We'll talk about some of them later. But in type 2 diabetes, that's the core of the problem, that you're still making your own insulin, which is the hormone that lets you use the sugar, but your body it's not as effective as it was before. So it's not as good at getting that sugar inside of your cells to use. Yeah.
It is type 2 is more preventable than that.
It's preventable, yes. It is more preventable. Yeah. Correct. And we'll talk about some of those risk factors later and how we can address those. But it is preventable, which I like because it means that I can do something about all of the types of diabetes, but I can really prevent this kind of diabetes, which is, a pound of prevention is worth an ounce of cure or something like that, or vice versa. So yeah, we like to prevent these things before they start. So briefly, there's another kind of diabetes called gestational diabetes. I won't spend much time on this, but basically pregnancy can cause diabetes, and it can put you at higher risk. A person who's had gestational diabetes or diabetes of pregnancy is higher risk to develop type 2 diabetes later. So then this is a very important topic. Pre-diabetes also called impaired fasting glucose is another name you might hear. Pre-diabetes really just means you're at higher risk for developing diabetes. We'll talk about how you sort of diagnose diabetes and pre-diabetes, but this is very common. I saw a recent estimate, the CDC thinks that 1/3 of everybody in our country has pre-diabetes. And almost everybody who has it, 9 out of 10 people who have pre-diabetes don't know it. So that's a huge number of people walking out there at higher risk for developing diabetes. This is also reversible, like type 2 diabetes, if we catch it soon enough. Oftentimes we can prevent or delay its progression, its progression to type 2 diabetes. And like I said here, it is a warning sign for the development of diabetes. So we've gone through all the 4 types of diabetes, or concepts around the types of diabetes. What's the problem, right? We have all this glucose, all this sugar in our blood, and it builds up in our blood. What's the problem with that? Why is that a problem? Well, what ends up happening, very, very basically, is that sugar, that glucose in our blood, it encourages damage to our blood vessels. We have blood vessels all over our body. There are big blood vessels, there are small blood vessels, there are microscopic tiny blood vessels. Blood sugar, diabetes, causes problems in all of them. It causes inflammation in the blood vessel walls. It causes atherosclerosis, or development of plaques in the blood vessels, all of which cause problems where those blood vessels are going to. Right? Blood has to get to our tissues, our organs, to work. And the more inflammation we have, the more problems we have in those blood vessels, the worse our symptoms get, and the worse our disease affects those organs. So the basic problem is too much sugar causes problems with blood vessels, which causes eventual problems with our tissues and our organs and our cells. So then the question is, how does that damage to our blood vessels make us feel? What are the symptoms of diabetes, or what's the problem with diabetes? So many people feel nothing. Many people have no symptoms of diabetes. And actually, I would say most commonly, people probably don't have any symptoms to start, which is kind of scary. As diabetes kind of progresses, many people start developing more of these symptoms. And so we'll go through some of them here. But all of these symptoms, as we'll see in a second, are related to the damage to those blood vessels all throughout our bodies. So the first one that I'd like to talk about is blurred vision, or trouble seeing. We have tiny blood vessels in our eyes, and inflammation in those blood vessels can cause damage to our eyes, and over time can make people who have diabetes go blind. And so that's a big thing to watch out for with diabetes. Feeling hungry all the time, feeling thirsty all the time, and a frequent urination are 3 things that kind of go together. And the reason is that it's kind of complicated, but the core reason is that when you have a lot of sugar in your blood, you pee out a lot of sugar in your urine. So you have, and when that happens, there's a lot of water that comes with it. The body just likes to keep those things the same. And when you have a lot of urine, then you go to the bathroom a lot, but you're also urinating out all of this food you're eating, all this sugar, all this fuel. And so your body is losing a lot of that sugar, and your cells can't use that sugar. The insulin isn't working to help the cells take that sugar in, so you feel hungry and you feel like you want to eat more. As people who have certain kinds of diabetes can lose weight because of that, like urinating out all that sugar. You can also have poor healing. So some people get ulcers or sores on their feet or other places, or they have infections or wounds from whatever, and then you don't heal as well, because part of the healing process is getting blood and immune system cells, like white blood cells, to where you need to heal, to the part of your body that needs healing. And if the blood's not working so well, the vessels aren't working so well, you don't heal as well. Feeling tired and weak, numbness or tingling in hands is a big one. You've got nerves in your hands and your feet. Everywhere you have nerves. And if you have reduced blood flow because of damage to blood vessels, then your nerves start not behaving right. They start getting what's called neuropathy, which we'll see in a second. But that's tingling and burning in your feet usually first, and then your hands. nausea and vomiting can come along with diabetes if things are getting really bad and your blood sugar goes very high and you have what's called a diabetic attack. The technical term for that you might have maybe have heard is a big word called diabetic ketoacidosis, which just means the diabetes is way out of control. So, yeah, it's called diabetic ketoacidosis. It's a big long word that just means very out of control blood sugar. So what are the risk factors? We were talking about one of those risk factors. Do you guys know any other risk factors? I put them all up here, so I kind of gave it away, but what other risk factors are there for diabetes? Anybody? You can just shout them out.
Inactivity.
It's a good one. Obesity. Smoking.
Eating too much carbs.
Eating too many carbs, you said?
Carbs.
Yeah, carbs. Good. Those are all good risk factors. I mean, those are all risk factors. Obesity is a big one, and one of the reason that we think it's a risk factor is that if you have more cells, you have a bigger body mass, you have more cells, your pancreas has to make more insulin, and so your cells see a lot of insulin and stop paying attention to it. It's kind of a reaction that happens in the body. Inactivity or sedentary lifestyle is a big, lack of exercise is a big risk factor, and the reason is that as we exercise, our bodies use more of that sugar, and so it helps bring our blood sugar down. So if we don't exercise, then we don't have that, and we have more blood sugar and less insulin around. As we get older, unfortunately, we have more of a risk for diabetes. Having a parent or a sibling, having a first-degree relative with diabetes is a risk factor. Like I said, gestational diabetes or diabetes of pregnancy. Having pre-diabetes, like we talked about, is a risk factor. And then I think someone mentioned high blood pressure and high cholesterol too. All of those things add into our risk factors for developing diabetes.
Stress.
And stress is a good, yep, definitely. Stress, go ahead.
But it is obesity, and it is growing among young people, right?
That is true.
Is there a connection to them video games and computers?
It's a good question. So there is a connection in that people who spend time playing video games on the computer, watching TV, may not be exercising as much. So everything in moderation. Sorry? The question was about fast food. Yeah, fast food is a big one, and we'll get into the dietary recommendations. But fast food is a big reason that causes obesity. All right. So I mentioned some of the symptoms you might feel. I'll talk about briefly the complications of diabetes, which are what we call complications are when you have diabetes, what it does to your body, and we call them complications, kind of the things that happen because you have diabetes. Nerve damage, like I mentioned, can give you neuropathy or the tingling in your hands and your feet. Retinopathy is the damage to blood vessels in your eyes, the retina. We call it retinopathy. That can cause that blurry vision. Kidney failure is a real insidious problem with diabetes. So your kidneys have all these tiny little blood vessels in them. And when there's a lot of inflammation in your kidneys and those blood vessels, your kidneys stop working quite as well. And over time, that can actually cause your kidneys to stop working. We need our kidneys. We got them for a reason. So if they're not working, that's real dangerous. And that can actually lead to a need for dialysis later in life, which is a machine to do your kidney's job for you. Then there are the other complications, which are bigger blood vessel complications, so big blood vessels. Stroke can be a complication of diabetes. So you have risk factors for stroke that are similar to the risk factors for diabetes, but a stroke is when you have lower blood flow to the brain, and so you can have strokes from diabetes. Heart attack, that puts you at a higher risk for heart attack, and also for reduced circulation to your limbs, to your feet. Usually it's to your toes and hands, to toes and feet and legs, which can cause wounds that aren't healing, and eventually the need for amputations, which is a scary complication of diabetes. Many people who have advanced diabetes, they develop these wounds on the bottoms of their feet, and they don't heal because they got poor circulation, and they eventually need surgeons to help them remove the piece of their body, their toe or their foot, that's really infected and not healing. It's a really bad complication of diabetes that we really want to prevent. All right, so let's step back a bit and talk about how we diagnose and how we monitor diabetes. So when your doctor is concerned about diabetes, he or she will ask you to get a blood test or several blood tests that will check the level of sugar in your blood. So over the course of a day, you can see that I put a graph there on the right. It's a little cartoon graph of how your blood sugar goes up and down normally over the course of a day. So in the morning, it's typically the lowest it'll be all day. It's a normal level of blood sugar is between 70 and 130 or 40. Somewhere in there is normal, considered normal. After you eat breakfast, your blood sugar goes way up. It's normal. It should go up because you're just eating all this food. All that sugar is going into your blood. The glucose is going into your blood. So your sugar goes way up. Your body responds by producing insulin, and then your blood sugar comes back down to a more normal range in the 70 to 100 level. The same thing happens at lunch and dinner. When you eat, you get more blood sugar. When you're fasting or after you finish eating, your blood sugar goes back down. So a normal blood sugar is between 70 and 130 or 140. It's a problem if the blood sugar is too high or too low. That means that diabetes or your blood sugar is out of control. It doesn't take much. So the other picture on here is kind of a cartoon representation of how much blood you've got in your body. You have about 5.5 liters, or about 1 1/3 gallon milk jug of blood in your body. There's 1 teaspoon of sugar, of table sugar, is all you need is the normal amount of sugar in your blood. So take 1 teaspoon of sugar, put it in 1 1/3 gallons of blood, and that's how much sugar there is in your blood. So it doesn't take much. So this is what that looks like. If your doctor asks you to take your blood sugar, they may give you what's called a glucometer, which is a machine where you prick your finger and take your blood sugar, and it'll give you a number that will go up and down depending on what you're eating, your medications, all those things. It's called a glucometer. A different test that your doctor may order, and I actually order this one a lot, is called a hemoglobin A1C. What it measures is your average blood sugar over the past 3 months. So if your blood sugar goes up and down over the course of a day, normally, taking your blood sugar at any one point isn't a great, it's just a snapshot, right? It doesn't represent what your blood sugar is running most of the time. If your blood sugar is really high most of the time, and then you stop eating and it's lower, and you take it, it might be falsely low, and we might not get a complete picture of what your blood sugar is running over the course of the whole day. So this is a test that shows us an average over the past 3 months. And the numbers are a little different than the glucose reading that you take on your finger. It's in percent. A normal hemoglobin A1C is below 6.5. Above 6.5 means you have diabetes. So any number that above 6.5 is diabetes. Below 5.7 is normal. Between 5.7 and 6.5 is pre-diabetes. So you can see in the yellow, 5.7 to 6.4 is pre-diabetes, or that higher risk for diabetes. Higher than 6.5, that means you have diabetes. So this is a test that we typically do every 3 to 6 months to a year, depending on how controlled diabetes is. And it gives us an idea over the long term how the diabetes is doing. Yes?
How does the blood know what you've had over 3 months?
The question was, how does the blood know what you had over the past 3 months? Yeah, it's a great question. And the way that the test works is a little complicated, but the way it works is your blood cells have something in them called hemoglobin, which is a compound that carries oxygen. And over time, that compound, that molecule in your blood cells, gets changed, or we call it glycosylated. It just means that there's glucose pieces that hang off of that molecule. And the higher it takes about 3 months for the amount of glucose in your blood to change those compounds in your blood, that hemoglobin. And so your red blood cells stick around in your blood for about 3 months. So they're seeing an average level of sugar over the course of the day. And so while the sugar in your blood goes up and down, that red blood cell stays there. And we can kind of look at it and see over the past 3 months about what it looks like. And it gives us a glimpse at the average sugar. Does that make sense? So then the question is, well, okay, maybe I've got diabetes, or I've been diagnosed with diabetes. What should my A1C, what should that hemoglobin A1C be? We say that a normal hemoglobin A1C is less than 5.7, like there, less than in the green or blue part of that graph, that cartoon. Typically, once someone has developed diabetes, we aim for a range of about 7 to about 9, depending on your health and depending on what your doctor thinks. It's a discussion that you have based on other health problems you might have, difficulty with medications and things like that. But the goal for getting that hemoglobin A1C under control depends on your health and the discussion that you have kind of one-on-one with your doctor. There are problems with your blood sugar being too low and problems with your blood sugar being too high, so we want to strike a balance. So besides monitoring the sugar in your blood, there's a couple of other tests that your doctor might do if you were to develop diabetes. The first one is a test called a microalbumin. It's a urine test, and your doctor is basically looking for protein in your urine. That's an early indicator that your kidneys are starting to be affected by the sugar in your blood, by the diabetes. And we usually do it every 6 months to a year, really every year, depending on how things are going. We also recommend visits to a podiatrist, which is a foot doctor, especially if you're having some of that numbness or tingling. It's called neuropathy. Regular blood cholesterol tests, or lipid tests we call them, are important to make sure that we control that and reduce that risk factor for diabetes progression. Regular visits to the eye doctor. So going to the ophthalmologist, who needs to dilate your eyes and look in the back of your eyes to look at those blood vessels, is important to sort of tell whether or not diabetes is starting to affect our eyes. Some doctors' offices have these retinal cameras, which you don't need to dilate your eyes. It fits over your eye, and they take a picture of the back of your eye, your eyeball, your retina, and they send that to an ophthalmologist who reads it. That's a satisfactory way of getting screened for this problem. If you do develop these problems, then you may end up needing to go see those doctors more regularly, either the eye doctor or the kidney doctor, the podiatrist. And then it's really important to just go to your regular doctor, your primary care doctor, your primary medical doctor, to check up on your blood pressure, on your weight, on smoking, other things that may optimize or make your diabetes improve. Finally, we like to give a plug for immunizations in here. It's related, it's not really monitoring, but immunizations are very important across the board. So it's controversial, but I think they're very important. There's the pneumonia vaccines, and there's 2 different ones as we get older than 65 that we need. There's 2 different ones, and then an influenza vaccine every year.
That's the flu shot.
That's the flu shot, yeah. So this part of the talk is focused on what we can do to prevent diabetes. So what we call lifestyle changes, there's a bunch of them, and these are changes that everyone, you and I, can make every day in our everyday choices to help us reduce the risk for diabetes and treat diabetes, actually. So the first one is diet. This is probably my favorite part of the talk. So this is what our plate should look like. In general, half of our plate should be vegetables, leafy green vegetables, vegetables of different color, but half of what you eat should be veggies. The other half of the plate is split in between healthy proteins, so things that are lean proteins, fish, tofu, chicken. We like to limit how much red meat we're eating, but occasionally it's okay. Lean proteins. And then the other quarter is healthy grains. So whole grains are typically what we recommend, things that have a lot of whole grains or whole wheat in them, whole grain. The reason that we like to increase whole grains and vegetables and fruits are that these things have a lot of fiber in them, and they typically have less sugar, less carbohydrates, and they sort of help our body deal with the sugar that we are eating by keeping us fuller longer. That's what fiber does. So this is what your plate in general should look like at most meals or over the course of the day. It's an example of some great foods that are healthy for diabetes. Blueberries, all these fruits and vegetables are great, all these whole grains. This is an example of good healthy food for diabetes. And again, it doesn't have to be all that you eat, but the more things that you choose from foods like this, the better. Example of some food that is not so good for diabetes. Pizza inside a burger inside a pizza. I don't know, it looks good, it probably is good, but in moderation, really not much of this. Have you ever seen a Philly taco? This is what not to eat. This is a cheesesteak wrapped inside of a pizza. It sounds actually pretty bad. But this is an example of, there's a lot of sugar in here. There's a lot of carbohydrates, a lot of fat. There's a lot of, a pizza, a slice of pizza. So again, this is the ideal, what we should be shooting for. It can be difficult to eat all of these things at every meal, but this is about what we should be eating.
You're not going to put ice cream on it.
It's good for a treat every once in a while. I think it is important to treat yourself. Even if you have diabetes, the trick is to just everything in moderation and to know what you can eat, and everything in moderation. So a big culprit in rising sugar and causing diabetes is sweetened sugary beverages, we call them. Coke, Pepsi, Mountain Dew, all these things. How much sugar do you think is in a 20 ounce? So, this is not quite 20 ounces, but 20 ounce Coca-Cola. There's a lot. There's actually this much, I brought a visual aid. There's this much sugar in a 20 ounce, I'll pass this around, 20 ounce Coca-Cola.
That's why it's so sweet.
It's that much sugar. There's a lot of sugar. There's about 60 grams or 12 teaspoons of sugar. It's a ton of sugar. I think there's not actually that many cubes, but there's a lot. So think about that when you drink your next Coca-Cola. 16 teaspoons. So it's about the same as 12 cookies. That's a lot of cookies.
This is 60 ounces.
60 grams.
60 grams.
So about 12 to 16 teaspoons, somewhere in there. 8 whole cups of strawberries. That's how much sugar is in there. 3 slices of pizza, 6 tablespoons of peanut butter, 3 donuts. That's a ton of sugar. There's a lot of carbohydrates in there too, like wheat and flour and other things like that. But there's a ton of sugar in these things. So be careful drinking your sweetened beverages. Okay, so that was diet. The next important topic is exercise and weight loss. Right? These are important things. Exercise itself helps reduce blood sugar. It helps increase our body's response to insulin. So the more we exercise, the more our body uses that sugar that's out there. And for some reason, the more responsive our cells are to insulin. I can't quite figure that out yet, but the more we exercise, the longer it delays the onset of diabetes or even prevents diabetes. So exercise is very important. Weight loss is important too. Like I said before, the more body mass we have, the more cells we have, the more insulin resistance, the worse that insulin works. Even starting at 5 to 10% of weight loss, even starting at 10 pounds of weight loss, just a little bit of weight loss goes a long way.
What about the opposite of that? If you're below your weight, like I'm underweight.
Yeah.
Is that any connection at all?
So the question was, if a person is underweight, is there any connection with diabetes? So I think being underweight probably is not a risk factor for diabetes. Some people who have diabetes experience weight loss, so there's a connection there. But being underweight is probably not a risk factor. Probably doesn't increase your risk for diabetes. Good question. So these are the exercise recommendations. Yes, sorry.
I just realized something. I have had diabetes for a few years, didn't really exercise, and then beginning day I started averaging 4 miles a day. And I suddenly realized I need afternoon naps. Is that connected, or I'm using up the sugar and getting tired?
That's a good question. So the question was, with more exercise, you started to notice you need more naps.
I never connected the two.
They could be connected. Actually, napping is very good for your health. So I would say regardless, I would keep doing it.
Napping is good for your health?
Yeah, I think so. Yeah, I like to take naps. It might be because I have a little...
I forget, it's been some months, but last night I was weighed up. I was 193 pounds on my 6'4". Is that am I okay?
I think it's hard to individualize a recommendation. You have to have an appointment with a doctor, but it depends on how tall you are, how much activity you're getting. I think we use what's called the BMI, or the body mass index, to really gauge a healthy weight. And so I would encourage you to talk to your doctor. So these are the recommendations from the American Diabetic Association for people who have type 2 diabetes. And in general, we say that people, and this is actually a recommendation for everybody, people with diabetes or without, we should be getting about 150 minutes of moderate intensity exercise per week. So that can be 30 minutes 5 days a week, 50 minutes, 3 days a week. Generally, what is moderate intensity exercise? Does anybody have any ideas what moderate intensity exercise is?
Push-ups.
Push-ups, that's one, yeah. Walking, that's a great one. That's my preferred kind of exercise. Bicycle riding, yeah. Not just sort of leisurely strolling, but you know, a brisk walk is a good. Swimming is a great exercise, even strenuous. I think can be pretty good exercise. There you go. So we typically recommend 150 minutes of aerobic exercise. So push-ups are kind of more strength training, but they can be aerobic too. So 150 minutes over a week. Then we recommend 2 to 3 times a week. It can be at the same time as you're getting your aerobic exercise, but some kind of resistance training, which is training on the machines, push-ups or pull-ups, Pilates, those sort of things that work on strength rather than just your heart pumping hard and your lungs working hard, aerobic exercise. The recommendation is for 2 to 3 times a week for flexibility and balance. Those are things like yoga and also Pilates. That can be at the same time as you're getting the other exercise you're getting, but that helps people, especially people who have the neuropathy problem in their feet, balance better. And then finally, it is recommended if you have access to it to participate in like a supervised training program with physical trainers or physical therapists. Just very little bit of exercise can go a long way. So just walking, just a nice moderate pace walk after a meal can lower your blood sugar and help prevent diabetes. So I would encourage you to get up and move. Just spend a little bit of time every day or every other day moving. 150 minutes, sounds like a lot, but even just a little bit is better than nothing. Find something you like doing and do it. So the other lifestyle changes that we can make are smoking is a really important one. Quitting smoking, there's ways that we can help quit smoking. Doctors can help you, or there are over-the-counter ways you can quit smoking. Lowering blood sugar, lowering blood pressure, so seeing your doctor regularly and helping control your blood pressure. And just seeing your doctor in general has been shown to help control and prevent diabetes. I'm not going to spend much time on this. This is a list of medications that we use for diabetes. They all work in different ways. You can see the names there. Metformin is probably the most common one that I prescribe. It's a safe and common medication that we use early on in diabetes and as diabetes progresses too. We can even use it in prediabetes or that higher risk for diabetes to help prevent progression to diabetes. The other big one on here is insulin. So we do prescribe insulin for patients. If your body has started to make not enough insulin, or your cells are resistant to it and you need more, then we can supplement how much insulin you're getting. And those come in 2 different kinds. There's an insulin that lasts all day long that we give once or twice a day. And then there's an insulin that we give with each meal. So if you eat a certain amount of food, you take a certain amount of insulin and it helps control that blood sugar. Other medications for your blood pressure, your cholesterol, aspirin sometimes is an important medication for diabetes, and other kinds of medications. But really, these are conversations that you'll have with your doctor about your own medical conditions that may be along with diabetes. So, I hope that wasn't too much information, but in summary, diabetes is really a problem of having too much blood sugar and not being able to use the sugar that's there, the glucose that's there. It's very common. We talked about the risk factors for diabetes, and we talked about what diabetes affects: your eyes, your kidneys, your nerves, your heart, your brain, pretty much everything. We talked about how to monitor diabetes and the lifestyle changes that can prevent and treat diabetes. And then we briefly looked into the medications that we use to treat diabetes. That's all I've got for you. What questions do you guys have?
So on diet, I noticed the first iteration of your plate had fruits and vegetables on the left side,
Yeah.
and the second iteration had all veggies. So can we talk a little bit about the impact of sugars coming from fruits?
Sure.
And can we meet that fruit and vegetable side of the plate just through fruits?
Yeah, it's a great question. So the question was, can I talk a little bit about the difference between fruits and vegetables on that vegetable half of the plate? So I like to say that fruits they do have tend to have more sugar in them than vegetables, and some fruits can have a lot of sugar in them, actually. The nice thing about fruits, though, is that unlike the refined sugars that are in our processed foods and in Coca-Cola or in white bread that we eat, those sugars that are in the fruits that we eat, they come along with a lot of fiber. Those fruits tend to have a lot of fiber. So fiber. So an apple has a fair amount of sugar, but it also has a lot of fiber in it. And that fiber helps our bodies more slowly absorb that sugar and also to stay full a little longer, to help us eat a little less in general. So I would say that whole half of your plate that was fruits and vegetables or just vegetables, I wouldn't just eat fruits. I would say, a good portion of that can be fruits. If I would advise my patients, the majority of that should be vegetables, but a sizable minority, like a third, can be fruits. Fruits are great. Yeah.
The new medications like Victoza, what are those?
It's a great question. They all work differently. And so those medications, so it's actually the mechanism for diabetes, or the reason that our bodies develop diabetes and how we treat it. There are 100 or 1,000 different little molecules in our body that affect the blood sugar and our cells' use of blood sugar. So some of those medications help us get rid of some of that blood sugar by urinating it out, which I said before was a bad thing, but sometimes if we're treating diabetes, we can use that. Some of them affect some of our sensors in our stomach that help make us feel more full, and so we eat a little less. There's a whole bunch of different ways that those medications work. So Victoza does some of those. Good question.
I have a question.
Yeah.
It's just like a typical checkup, doctor's appointment. Is this something that medical professionals would be screening for, or is it something that someone sort of has to ask for or express that they have a concern?
That's a great question. So it depends. I think many doctors will screen for diabetes if they have a concern. So if you have the presence of some of these risk factors, if you're a smoker or you have high cholesterol or high blood pressure, your doctor may be like, I should probably screen you for diabetes.
I know years ago when I was in psychiatric hospital, they tested my finger a couple times. I don't know why, I guess it was just in the blood sugar. I don't know why.
And we test in the hospital. We test for blood sugar, blood glucose all the time, and it's typically a part of our routine study that we do in the hospital. So, and sometimes people who are in the hospital, their blood sugar can go up and down very differently than when they're at home. And so we try not to base our decisions to diagnose someone with diabetes based on their time in the hospital. Based on their time in the hospital, if there's something else going on. But it is a good question. I would encourage you all to ask your doctor about diabetes and whether you're at risk for it, and then to be tested for it. Most of us have risk factors for diabetes.
Maybe I missed it. Is alcohol, most alcohol is more sugar?
That's a great point, and I did leave it out of this. So alcohol is a lot of alcohol consumption, or even moderate alcohol consumption, can predispose you to develop diabetes. It really can. It can cause weight gain itself, but also, like you said, it can be turned into sugar in the body. So it does make your sugar go up. And some alcohol has a lot of sugar in it. There's some sweet wines and other things that have sugar in it. So it's a great question. Yes? That's a great question. So, does hepatitis C play any role in diabetes? So there's a connection in that hepatitis C can affect your liver. It does affect your liver, and your liver does a lot of things. And one of the things that your liver does is produce other hormones besides insulin. I don't believe that hepatitis C, that the liver problems that you develop with hepatitis C really affect diabetes, but I'm not totally sure.